Me, Dr. Groom. A big bonjour and a good morning and also assalamu alaikum to all of you. I'm here as the Director of Health and Social Development, also representing His Excellency Dr. Workneh Gebeyehu, who have been also wished to be among us, but also we're having a summit meeting in Nairobi, and also I'm just here conveying his greetings to all of you. His Excellency, the Permanent Secretary of the Republic of Djibouti, Dr. Salah Buneita, His Excellency, the Ambassador of the European Union, Mr. Aidan O'Hara, our Chair from Sudan, and also our development partners. I will start with UNOPS, who is actually our main partner in this project. Madame Roselle also representing the director of UNOPS, regional UNOPS. And also let me also welcome the representative of GIZ, Mr. Gunter also is here, also an important partner in this project. I would like also to welcome la representative de l'OIM, IOM, Madame Stéphanie, who is also here, and also the representative from the East African Trademark, also my colleague from Africa CDC, Dr. Achen, my colleagues from IGAD Secretariat, from Member State, the Regional Emergency Unit, but also our delegates, which are so very important, representing our different Member States. A very good morning to all of you. Excellencies, as you all know, this meeting of 5th Steering Committee is a very important meeting, and has also, Dr. Groom have said, this is one of the high-level organs which is actually overseeing the current project of the EU-IGAD COVID response for the IGAD region. Distinguished delegates, it's also my great pleasure to highlight the major program of this project, and also which is also complementing the IGAD member state efforts on the COVID-19 response. The EU-IGAD COVID response, under the name EU-IGAD Response to Health and Socio-Economic Impact of COVID-19 in the IGAD region, has been now for the last 2 years implementing by all partners. IGAD as the coordinator, UNOPS as the fund of management, and also UNICEF, IOM, East African Trademark, who are also our important implementing partners, but also, of course, very important, are also member states who are implementing this project in their respective countries. We also wish to also highlight the generous support from the European Union, because the European Union has been the first partners who have actually come to IGAD after the summit, extraordinary summit of our head of state, actually, which has met together in 2020 when the pandemic has exploded. And as you all know, the project that we are implementing together intend particularly to benefit the vulnerable population, like the refugees, the migrant, host community, and because also what we know is that as the IGAD, our efforts is to complement what member states are doing, and also has a niche. What we know is IGAD has the Intergovernmental Authority on Development. Our ministers have declared in 1996 that IGAD need to work with member states, particularly for segment of populations, including the host community, the migrant, the refugees, the IDPs, because these populations are not in their national plan. So having IGAD, particularly with a health desk, it will bring the effort of member states to work together and to address their needs. Of course, for now we have the COVID-19, but also let me remind you also IGAD, we are working on the HIV, AIDS, and TB and malaria, the maternal and child health, and also we have other issues of health for the last 20 years. Delegate and Excellency, since its outbreak in 2019, the COVID-19 pandemic has claimed 6.3 million lives globally over a period of 2.5 years. And also the pandemic has also a huge impact on the cultural, social, and economic activities worldwide. Closer home, the IGAD region also has seen over 1 million cases reported with a case fatality ratio of about 2.1. The program also, the IGAD EU COVID-19 response program, was conceived with the intention of complementing, as I have said, the efforts of our member states in addressing and also with particularly focus for this segment of populations which are moving along the 8 borders of our region. This project steering committee today that we are having, the 5th, is also, the steering committee is a regional platform which also provide us, member state, partners, donors, to review our progress, but also to chart together. I think now that we are almost coming to the end of the first phase, how we can maximize the gain of the people of the IGAD region. Excellencies, delegates, and partners, among the many achievements that will be presented today with details in the course of this meeting, I would like also just to briefly highlight 2 that are aligned to the IGAD institutional mandate of fostering regional integration agenda. Because as you all know, IGAD is one of the regional economic community from the East and Horn of Africa, which is also one of the REC among the 7 regional economic community. Let me just highlight the first one is in Mombasa recently, the endorsement of the health data sharing and protection policy by our IGAD Minister of Health in Mombasa has been a big milestone. This also has laid for a good foundation that also currently ongoing work establishing a regional disease surveillance system that also would go a long way in fostering the pandemic preparedness of our region. We are also working closely with GIZ, but also another partners like also the World Bank. The signing also of an MOU, Memorandum of Understanding, between the Minister of Health of Djibouti and the Minister of Health of Ethiopia on the vaccination of truck drivers in the Ethiopia-Djibouti transport corridor has been also a big milestone that also we like to replicate in other cross borders of our member state. But fostering such collaboration between member states to address concerns that transcend their individual jurisdiction is also a core reason for being a regional economic community like IGAD. Excellencies, delegates, I would like also to stress that we are not yet out of the woods, but also as a region, we have grown and improved our response to this pandemic with our partners, with the support of the European Union particularly, and also German cooperation, and also the BMZ and African Development Bank. Yet, some gaps are yet to be plugged. For example, the vaccination is still poor, and the capacity to manufacture it, this is non-existent in our region. And this is also important that we have the African CDC presented here. Now also the threats continue to emerge. For example, the monkeypox and the avian flu are also this disease among us. Donc, our response to this challenge, in the words of our Executive Secretary, His Excellency Dr. Workneh, is that there is no alternative to enhancing the regional capability to test, trace, and vaccinate. And in other words, we need to strengthen the health system in the IGAD region. In conclusion, I would like also to urge all our delegates from the member state to make a concerted efforts in this 1 day, but 2 days, because tomorrow also we are having a closed session with our member state, and also to appraise yourself on the project achievement and to constructively guide the upcoming phase for the benefit of our member state. At the final point, allow me also to acknowledge the great supporters and also with highest appreciation to all in this partnership. And also, I sincerely appreciate the good work of our expert support at all member states, and also the great team working in the partner organization, particularly the dedicated leaders in all the technical and administrative team in European Union, UNOPS, GIZ, IGAD Partners Forums, and also our international partners like IOM, East African Community, and also UNHCR, when we are also working on another program on the Global Fund addressing the issue of refugees in the 8 refugee camps. Excellency, let me thank all of you for the great achievement and also the continued support to the response accelerated, and also are highly indebted to our general supporter, again, the European Union, for the critical support. Let me thank all of you. Merci beaucoup, and have a great discussion.